Hello everyone. First of all, thank you for supporting during my disease and for your kind messages. I decided to talk about it in stories since I was infected here in Dubai, and this information can be useful for you also, and you can know when you should go to emergency. I started to feel numbness in my hands, just bad day when I have pain everywhere, just so I made like that. It was almost 40 degrees. It was one of the hardest thing for me. 100 kilo of leads all over my body, just like lay down in my bed, salty, even water. I went in washroom, a lot of blood. I wanted to sleep, but I have so strong itching. So that day I started to feel some weakness and pain in my back and knees. Then the pain went down and I started to feel numbness in my hands and feet, and even convulsion, some small convulsions in my legs. Since I had before some pain in my back or knees, I decided that it's just a bad day when I have pain everywhere, and I just took a very strong painkiller. It helped me a lot. I worked that day and I felt very stressful, very nervous, like I tired so much and I just want to lay down. When I came home, the pain in my joints and back accelerated. The head was so heavy and I started to feel strong headache. I decided to take a shower and then go to bed. And while I was in bathroom, the water was so hot, but I felt so cold, and I started to have convulsions of my muscles everywhere on my body and also on jaws, so I made like that, very heavy. Then I went to bed. I still felt very cold, even under a very hot blanket. The convulsions throughout all my body and jaws continued. And after maybe only 20 minutes, I felt that my head is very hot. My forehead is just like a fire, but my arms and feet very cold. We measured the temperature and it was 39.8. It was almost 40 degrees. But if you touch my arms, they were very cold. That was white fever. And the dangerous thing about white fever is that outside, like your arms and legs, they are very cold, the vessels are constricted, but inside your body all organs are too much hot, and this is very dangerous condition. I took Panadol and Noshpa to enlarge the vessels, and with time my hands became hot also and my temperature went a little bit down. Next day in the morning my temperature again was 39.5 and I felt very bad. We went to emergency and the doctor had a look. He gave me Panadol and ibuprofen for my fever, but ibuprofen actually is prohibited when you have dengue fever. I got my blood test only on next day, and when I saw that it's dengue fever, I was hospitalized. What I had throughout all that days: first, it was high temperature, like 39, 40, about 4 or 5 times per day, so I took Panadol for it. All my time I had IV drips. I feel so strong pain in my back and in my knees, in my legs and muscles, joints. The pain was very strong for 2 days. On third day, it became more tolerable. After that, it was very strong weakness, and I just lay down in the bed, and it was very hard to go to washroom, especially with IV drip. It was one of the hardest thing for me. And I felt always a very strong headache, and I can't take ibuprofen, only Panadol. I felt that I had like around 100 kilo of leads all over my body, and I was just like lay down in my bed, and I can't move a lot. I can't stand. It was very, very hard. Then I didn't have any appetite. I can't eat. Doctors every time went to my room. They told me I must eat, and the dietitian also gave for me special protein puddings and cocktail, because I forced myself to eat, but actually I didn't want at all. It was good if I ate a quarter of a dinner or a lunch. I felt salty taste of almost all foods, and salty even water. It was so hard to me. It's salty inside my mouth, everything, and the food is also salty. Even now I feel some salty taste in my mouth, and some food is very salty and I can't eat, especially meat. Then I started to have vaginal bleeding, and one day it was really very strong, much more than usually in period we have. Just when I went in washroom, a lot of blood, and I started to have some bleeding in my nose, but not so strong. Every day nurses checked my blood tests, and I was very scared when my white blood cells were only 1.4. It's really very low level. And my thrombocytes went down with every day until one day they reached only 41. It's really high risk of bleeding, and I had some kind of bleeding. Fortunately, that day I started to feel myself a little bit better, and I even can sit in the chair for some minutes. Next day my blood tests become better. I started to have a rash, another thing in this disease. It was very strong itching. I had so strong itching through the whole day, nothing helped me. Antihistamines, zero effect. All lotions, zero effect. I wanted to sleep so hard, especially after antihistamines first generation, when they had a very, very strong sedative effect. I wanted to sleep, but I have so strong itching in my palms and in my legs that I can't sleep. At night I asked for sleeping pill, and after about half an hour I fall asleep. But next day it was the situation, maybe 70% of itching from the last day, but it was the same, very, very strong. The temperature was better, like about 38 and 5 degrees. The main problem was itching that day also. And then next day the doctor discharged me from the hospital, and I came to my home, and I was really happy. I felt better, the itching was less, the temperature already, I didn't have temperature, like maybe only 37, and I started to recover. What I have now It's very good that I don't have headache, but I have weakness. I have a salty taste in my mouth, and some food is very salty for me. I can't eat it. Itching stopped yesterday, and after 1 week I must check my blood test, like white blood cells and thrombocytes, and also some tests for liver, since this dengue fever affects on liver also. I had fever in common for 7 days. On about 4th day I started to have rash, and on 5th the itching started. The bleeding was on 3rd day for about 3 days. Actually, what you must do if you have dengue fever. If you have very high temperature for more than 2-3 days, it's better to be hospitalized. If you feel yourself very bad, very strong weakness, especially more than 2-3 days, it's also better to go to emergency. If you have bleeding, doesn't matter from where, vaginal bleeding, bleeding from your nose, from your gums, or if you have rash and it's like small bleeding dots on your skin, it's also the reason to be hospitalized. Every day you must drink a lot of water. You must check your blood so the doctors can control the level of thrombocytes, and when it becomes too low, you will be hospitalized. The prophylactic is to avoid areas with a lot of mosquitoes. Especially don't be a lot outside after the rain. Use repellents. Don't sit outside, especially in cafe or restaurants, if there are mosquitoes. And remember, first case of dengue fever usually is not so strong and doesn't have bleeding symptoms. But if you will have a second case of dengue fever, usually the disease become very hard and severe with bleeding symptoms. It's better to have vaccination for those people who had the first case of dengue fever. But unfortunately in Dubai we don't have vaccination, in Russia also. But I hope with hot weather the mosquitoes soon will disappear in Dubai and all will be okay.